Maryland's currently home to 235 nursing homes, all of which are facing monumental changes following the passage of the health care reform and the effect it will have on long-term care in this country. How do you see long-term care in the future, and as providers, how are we to continue to provide the quality of care to our frail and elderly population and also grow workforce with the challenges that we face and the cuts at state and federal levels?
Obviously, so much is driven by federal policy when it comes to many of the issues that you deal with and much of the funding that you deal with. The state of Maryland has tried to stay on the cutting edge of making sure that we provide for long-term care for residents, for our citizens. It's becoming a real challenge, trying to meet all the federal requirements, trying to conform to the changes brought about by the health care reforms. Where do I see it going? It's a dynamic environment, and companies like yours are going to have to stay on the forefront. I think that we need to continue to work together. One of the things that I've always believed in is you need to listen very carefully to the constituencies, HFAM and other organizations that come out and say, look, I understand what you're proposing, but understand this is the real impact. You know, and to be able to come out and visit and actually see the impact on individuals is really what it takes sometimes to understand, all right, we're setting a policy to do this, this, and this. It sounds good and it may seem like it works on paper, but you see the end result, and so we need to continue to work together as we move forward to make sure that we're doing reasonable things for our folks.
As we watch the timeline for accountable care organizations revving up and long-term care providers are evaluating a buy-in to this coordinated care model, are you familiar with ACOs? What's your opinion, if any, as to whether long-term care fits into the delivery of health care, and why or why not?
Do I believe that they're an important part? Yes. I think that if we continue to go down the road that we're going, they're going to play an important role and a valuable role ultimately.
Okay. Lastly, tort reform, as you know, has been a big issue at the state and the federal level. President Obama pledged in his 2008 campaign to push for tort reform. Governor Haslam in Tennessee supported, and the legislature passed tort reform. As providers, our cost levels and insurance rates are steadily on the rise and are having to defend many lawsuits. We know that there's been federal legislation introduced this session, and would like to know what your thoughts are regarding tort reform here in Maryland. Do you see a light at the end of the tunnel at this issue?
With regard to tort reform, especially here in the state of Maryland, there are some proposals in the Congress, but in the state of Maryland, we made some changes in 2006-2007 timeframe. We definitely will need to revisit that as we do every year. But are we at the point of making some major reforms? I don't know. We may be a few years away here in the state of Maryland. Kind of waiting to see what happens at the federal level.
Just one more question.
Sure.
You've been in the Congress in Maryland now since 1999. Any thoughts of running for governor?
No. None. Easy enough. None.
Okay. Thank you for your candor.
You bet.
And thank you so much
All
for
right.
coming to visit our building.
That's
Really
good.
appreciate you
All
being
right.
here. Thank you
Yeah.
so much.
Good to see you.